After weeks of declining coronavirus numbers worldwide, the World Health Organization has recently reported a 10% increase in global COVID cases.
Here with us is the World Health Organization's COVID-19 technical lead, Dr. Maria Van Kerkhove. Dr. Van Kerkhove, thank you for being with us. And please, a lot of people just want to know what is responsible for this uptick. Are we talking about those variants that we've heard so much about?
Well, thanks for having me on the show. Indeed, one of the reasons why we're seeing an increase in transmission across 4 of our 6 WHO regions partly is because of these virus variants that are circulating around the world, many of which have increased transmissibility. But there are a couple of other factors. First, we have difficulty in complying with proven measures that are in place, and there's a pressure to open up societies. If we open up societies and we don't have people adhering to the measures in place, the virus will spread. And the other reason is that we have vaccines that are rolling out, and this is an incredibly hopeful and promising aspect to controlling this pandemic. Its rollout is uneven and it's inequitable. And so it's going to take quite some time to actually reach the people that need to be vaccinated around the world. So it's a combination of factors of why we're seeing increased transmission.
And Dr. Van Kerkhove, is there an area or even particular countries in the world that are most of concern right now?
We have seen an uptick in cases in India. We've seen an uptick in cases in a number of countries across Europe, spreading eastward into the eastern part of Europe. And a lot of this is driven by some of the virus variants, this B.1.1.7, the virus variant first identified in the United Kingdom. We have seen some increases in transmission across a number of countries in the Americas, namely in Brazil, but also in other countries as well. And so it does vary around the world. But I do want to say, even with these virus variants, they can be controlled. They can be controlled with these individual level measures that we have, the physical distancing, the hand hygiene, the mask wearing, avoiding crowds, respiratory etiquette. We need to adhere to the measures and really do everything we can to keep ourselves safe, even as these vaccines are being rolled out.
Dr. Van Kerkhove, you've actually said that the world is still in the acute phase of this pandemic. Tell us what that means, and perhaps even looking to the future, what the next phase would then be.
So being in the acute phase means we still have to put in all of the work with the individual level measures, the community level measures, the vaccines and the vaccination being rolled out around the world. But it is absolutely critical that vaccines reach those who are most in need in all countries. These are frontline workers, health workers, people who are of advanced age, people who are most at risk of developing severe disease in all countries, as opposed to vaccinating everyone in only a few countries. This is really key. And as these vaccines are rolled out, we will start to see a decrease in severity. We will start to see a decrease in deaths due to COVID-19, and it will have an impact on transmission, in addition to the individual level measures that we have. If you want to think about the future and you want to think of hope, look at countries that have actually controlled this virus. Look at countries in the East and the Pacific, at Australia and New Zealand, many countries in Asia who have their societies opening up as they go about their lives and just being at the ready, so that any cases that show up, any clusters that show up, the countries really act aggressively to make sure that that doesn't allow to spread. The variants pose so many challenges for us ahead, and it means that we have to remain at the ready and use the public health infrastructure that has been built around the world, that has been strengthened around the world, to make sure that this virus doesn't continue to have a hold over us.
And Doctor, you've been talking about the vaccines. We got some positive news about the phase 3 trial of AstraZeneca here in the U.S., the 79% efficacy of this. But it has had issues around the world, and some places in Europe have stopped the use because of concerns over blood clots. What's you all's take now, and how important is it to get another tool, another vaccine out there in the pipeline?
Well, it's really critical that we have many safe and effective vaccines that can be used against COVID-19. The AstraZeneca vaccine has been evaluated by WHO experts as well as the European Medicines Agency, and they have determined that this is a safe and effective vaccine. And so we continue to advise its use around the world. It's currently being used in more than 100 countries right now. It is a safe and effective vaccine. So if you have access to the vaccine, we advise that people get vaccinated. This is another tool, as you said, say. It's another tool in our toolkit to be able to prevent the spread, to save lives. And we need to use everything we can at our disposal to make sure we prevent as many infections as we can and save as many lives as we can right now.
All right, Dr. Maria Van Kerkhove, WHO, we appreciate your time, your information, and your passion really so much. And we'll see you down the road. Thank you so much.
Thank you very much.
All right, up next, right here when we...
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.